So on to the next one. For anyone who's joined, we are currently in a webinar. We're talking about the trends and practices in occupational safety, health promotion, and uh, our next speaker is Dr. Yogindra Samant, and she's going to be talking about the changing nature of work now and beyond. And also, in addition to that, she'll also cover some of the challenges experienced in OSH, especially today. And we'd like to know to understand how can we take a fresh look at the way we work and the different technologies we can use to reduce the risks involved in OSH and also encourage safe working practices and improve efficiency within the different work environments. So we'd like to introduce you, Dr. Yogindra Samant. Welcome, and the platform is yours right now. Welcome. Thank you.
Thank you, Mary. Thank you, Abdul Qadir. I was wondering how I could share if you could make me the host, and then I could move on to the presentation. Okay, thank you.
Ali,
Go ahead.
Can you see the presentation now? Should be.
yes.
Right?
Thank you.
Okay, so this is working. All right, it's a privilege to be invited to this OSH Pro program, and hopefully I'll try to keep the time here. I would like to say, Habari za subuhi. It's early morning here in Norway. To start with, was that correct?
Yeah.
Very well.
Okay. Yeah. Okay. So I will be talking about the changing nature of work and beyond. And most of what I talk about is some work that we have done at the Nordic labor inspection authorities, Nordic countries, that is Norway, Sweden, Iceland, Denmark, and Finland together. This was a task given to us by our labor inspection, the OSH inspection directors. Much of this is based on that work. And hopefully, you would be able to see some parallels, both in history, but what is coming now and in the future, because globalization means that what technologies are in Norway are also there in Kenya. Maybe some things are happening here before, but they will also come in parts of Africa, or they're already there going ahead. So here is a short outline. On the left, you would see the report that we published last year, and this is ongoing work. If you Google it, you will find it. I can send the link afterwards if that is necessary. But I'll talk a little bit about historical perspectives to start with, because I think that is important, what we know about the history of occupational health. And then I'll keep on coming back to it as we move on to the challenges of OSH as they concern safety and health now and going into the future. So I will talk about platform work, and that is like Uber or food delivery platforms. I understand there are such in Nairobi. I'll talk about climate change, heat stress and change in climate. How does that lead to OSH? We'll talk about pandemics because it's relevant. Then about non-communicable diseases, what the previous speaker was talking about, Wafia, partly about psychosocial and musculoskeletal, but also some other things. I'll touch upon some new technologies, and I'll end up with migrant workers. But I want to say that when I talk about migrant workers, that's a poorly defined phenomenon. Migrant workers in Norway today are workers who are coming from Eastern Europe, from Poland and Baltic countries. But migrant workers in large parts of the world, of the emerging economies like Kenya and India and Bangladesh, they could be workers coming from poorer parts, from farmland, Norway, farmlands to the cities, which was a phenomenon that one saw also in Europe many years ago. So, as I said, the past is important. And this Venn diagram shows you the shaded parts is telling us how much of the past we know or how much of the present we know and how much of the future we know. In a nutshell, we know uh, most about the past, somewhat about the present, and least about the future. But it's very difficult to say what the future is going to bring in. But it's a continuum. It's a continuum. It is not silos. So what we have seen in the past, we will see in the future as well, and so on. So I'll start in the past here, about 1889. This is outside of Oslo, Norway. This is the matchstick workers strike, a watershed movement for occupational safety and health in Norway, and for the establishment of occupational safety and health administration, the labor inspection. So what you see here is a picture where there are women and small children, men, and they are striking to get better sanitary and better working conditions in the factory. But a couple of points to make here. Who are these workers? Now these workers have come, these are Norwegian workers who have come from distant parts of Norway, farmland Norway, to the city of Oslo for a better future for themselves and their kids, but they land up in, although they have migrated from farmland Norway to the city, but they end up in really exploitative working conditions. Another point I want to make here is technology. Matchstick is a technology that evolved around 1700s through 1800s to 1900s. So here, these workers were working with something called white phosphorus, which gave um, what's called necrosis, facial necrosis, because the vapor that came from white phosphorus led to facial scars. And that is a really bad chemical to be exposed to. In addition, these people were working 14, 15, 16 hours a day, and uh, they were getting extremely low wages. But remember, these were not workers because the concept of worker was not there. These were individual units, you could call them, or individual people who were employed. There was no regulation either. But with regards to technology, actually, the use of white phosphorus as a chemical in matchsticks at that point in time was an improvement on something called antimony sulfide, which is explosive, which called burn accidents, explosions, and many people died and there was loss of production. So the employers had improved on the technology, but that was not good enough. It took another 15 years before we moved from white phosphorus to red phosphorus. So regulation here took 15 years, but still, this was an important and a watershed moment because this led to engagement of politicians, celebrities that point in time, and eventually led to the establishment of the Norwegian Labor Inspection Authority and the Factories Act in 1893. So a couple of points here, right? Migrant workers were working time, child labor, technology, and many of these things you would see going ahead, especially when I talk about other factors. So I just wanted to set this up as a background. So in our project on the future of work, we talk about drivers of change. What are the things that are influencing occupational safety and health now and going into the future? So when you talk about technology, I will talk about platform work. I will talk about food delivery apps. I will talk about taxi apps, app jobs. That is what I would talk on technology. On climate change, I'll talk about how global warming and change in climate could and is influencing occupational safety and health. Globalization, that is, uh, and demography, that is more about, uh, migrant workers. It is more about um, talking about the changes at a global level, including pandemics, because globalization is very good. But if you think about it, the corona infection spread because we travel for work and we travel a lot and it carries the infection. So, but we have to think how that impacts occupational safety and health and what we could do as OSH practitioners. So I'll start with a classical chemical or other stuff, asbestos, right? And the first studies of health related problems of asbestos started coming up in 1930s and 40s, the first studies in Europe. But it was regulated in Norway in 1984. So it's banned the use and import, but it took 40 years. Having said that, asbestos was in use for a large part of the 20th century until 1984, which means, and the picture here shows, that a lot of our water pipes, under the ground in the buildings, they were insulated by asbestos. And they are still there, but they have lived, these pipes have lived their life, so they need to be changed. At many places in Norway, the asbestos pipes or insulation, we know there is asbestos, but many other places we don't know that there is asbestos in the older buildings, in the pipes under the roads. So you take a technology of the 20th century like asbestos, which is used all over the world for isolation, or used to, and you put it into something very modern. So this is a app that is found in Europe and in Norway, and I'm sure that you have something like this in Kenya too. I remember a few years ago there was something called Link. I don't know if it's still there, but the idea is any job could be put on an app, and then you can get somebody to do that work. So in this case, this happened in one Scandinavian city. A family bought an apartment, and the apartment needed to do some work because it had leakages in the wall, and some isolation needed to be fixed. So the man in the house, he put this work about fixing the isolation and fixing the leakage in the wall on this app called My Jobs. And then he got a lot of workers to or a lot of people, everything from 15,000 Norwegian kroners, which is about 1,500 euros, to to maybe 4,000 euros to do this work. And he chose somebody who gave him the option of 2,000 euros. This person who did the work said that I will do this work only in the evenings and on Saturdays and Sundays. And that is because this was a worker who was from an Eastern European country who was doing legal work in Norway during the daytime from Monday to Friday as a construction worker. But he said, okay, I want to have some extra money in the evenings. And he had registered for this kind of a job. But the job was done. He came in, the pipe was fixed, the leakage was fixed, the isolation was fixed. But and both the parties were happy, the man who had the apartment and the person who did the work, right? So everybody happy. But the thing is, this was an old building from 1960, so the isolation in the wall, the pipes, it had asbestos. And in Norway, you have to do, if you do asbestos work, you have to seek permissions, you have to take uh, various preventive measures, both hazmat suits and all kind of sanitary regulations apply. And that's why it costs a lot of money. But in this case, he just did as a normal job, which means the workers was exposed to asbestos, but probably also the family who was living in that house, because none of these preventive measures were taken in place. So essentially, you have old substances with new technologies. That's a dangerous cocktail. So going ahead, we have to be very careful about these things. So I'll talk about uh, platform work, as we call it in Europe, or gig economy maybe is more the word that you guys in Kenya and Africa use it. But you have taxis, you have food delivery, you have technical work like coding or designing, but I'll not talk about that because it's very difficult to regulate if somebody is doing some work on designing a website for somebody like me or an agency in Norway, let's say in Kenya or Philippines, because that's just outside our jurisdiction. And that is happening on various websites. But offline platform work, that means you're ordering work on the platform on an app, and it's happening in your country, in your city. And that could be Uber or these taxi companies or food delivery companies, uh, or Uber Eats or whatever it might be. So what we see in Europe is the following. Uh, Most people who are employed as self-employed persons, not as workers, and they tend to be young people, they tend to be students, they tend to be migrant workers. So we know from our data these are already vulnerable groups with regards to injuries and accidents and diseases, youngs and temporary workers and migrants and students, and then they have to work in these interesting circumstances. Don't get me wrong. I mean, this is a great opportunity to earn money. This is a great opportunity to get into work life. But shouldn't these workers also be getting the same protection as workers? Because what happens, for example, in Norway or in Europe is uh, Volt is a company that provides courier of food. So the person takes the food from the restaurants and delivers at your home. And the idea is uh, you deliver that using your own vehicle or cycle. Volt, the company, gives you a helmet and a bag. But they have incentive-based systems. That is to say, the more deliveries you make, the more money you make, which means there are a lot of accidents to this. And you could work for Volt and Uber at the same time. So in terms of working time, you could work in theory 24 hours and nobody would know. But that means you're exposing yourself to risk of accidents and injuries and psychological problems, because if you keep on working for 10, 12 hours every day and 14 hours um, every day, which would be 60, 70 hours a week, that's not psychologically healthy either. So that's one problem, that there is an issues of OSH. The other thing with these people is they are actually doing the same job as other workers in the transport sector, but they are not covered as workers because all of them are self-employed. And two, for example, Uber in Norway, the taxi company, that's not registered as a transport company. It is registered as a website, and a website is not regulated. So they misclassify themselves so they don't get regulated. Had Uber been a transport company, they would be required to have an occupational health services in Norway. Not the case today. So there are issues of OSH, occupational safety and health, and public safety, compensation, if one gets injured on the work. So with that said, maybe I should move on to the next part, which is climate change. And in Europe or in Scandinavia, we are getting more warmer climates, but I think that is also the case in Africa and rest of the world, where there are issues of climate change, and because of global warming, uh, the weather conditions are changing, and it has impact on occupational safety and health. How? Because we'll have and are having more heat waves, landslides, floods, and change in ecology, and I'll talk about that. But heat waves means our outdoor workers will be exposed to more heat stress. Our outdoors workers in the north might be exposed to more cold and extreme weather conditions. Our rescue workers, firemen, people who work after floods to clean up the floods, increasingly will be uh, put under more pressure or stress, because the extent of climate change might be more than today, and we know that already. So we have to think about that and do our risk assessments and plan our workforce accordingly, because these kinds of things are probably going to increase, which might put pressure on the occupational safety and health of firemen and police and rescue workers. Change in ecology, that might be also true for Africa, but in Europe we are seeing new kinds of vectors, new kind of viruses, bacteria coming northward. So diseases that were more in the tropics are now seen in Central and Northern Europe as well. For example, tick bites to our forest workers who work in the forest, right? So Borrelia, for example. So that's perhaps new kinds of diseases will also be seen because of globalization, because people are traveling, potentially not necessarily because of climate change, but climate change could also happen because we travel a lot, and then the emissions could lead to change in local and global temperatures. But the other piece is the response to climate change, right? Green technologies like electrical cars and solar energy and wind energy and recycling. For example, installation of solar panels is not the same as installing roofs. There are other kinds of hazards. And we have seen in Europe installation of solar panels on the roof leads to fall from heights because the risk assessments are different than just working from heights. And then we have something about wind energy and turbines, again, working from heights, electrical cars, and this is more relevant for Africa. Norway is the country that is using, that's per person, we have most electrical cars. But you know where the batteries elements are coming from, largely from Africa, Democratic Republic of Congo. So this is not necessarily climate change, but an example of globalization, that a lot of child labor and 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 um, and exploitative situations are happening because cobalt is needed for batteries in electrical vehicles. So we need to work globally together to address these challenges as well. I'll move on to pandemics here. What we saw, at least in Norway, in the pandemics, and my first 2 points on there, was that there was an issue between public health and occupational health services because the public health authorities did not think about occupational health issues in their emergency preparedness planning. Norway and many European countries have emergency preparedness plans on the national level and the regional level and the local levels. But the emergency preparedness plans did not include occupational health risk because you will have doctors and transport workers and nurses who have to work during the pandemics. And that was something we found was lacking. So we we think in the future pandemics, when people plan for emergency preparedness, disaster preparedness at a national, local, or regional level, occupational health risk assessments have to be integrated. So that's one issue, and hopefully, even in Kenya and other places, that will be included. The other thing was in March. Norway was closed down. Many European countries were, and people who had the luxury of it were working from home. So when you work from home, you have one, you could have ergonomic risks because you might not have the proper desk or screens or the mouse to work with. And again, working from home also means you might have too much of screen time. You would be sitting most of the day. You don't get enough daylight. You don't get enough fresh air. All that will impact your health. It will impact your ergonomic health because how you sit and work, and it will impact your psychological health because you're sitting on the screen all day for hours. You don't have colleagues to have direct interaction with. Your leader, your manager might be sitting somewhere else, and that will cause isolation and lead to psychosocial risk. That is what we are seeing in Norway from the data that we have. Um, because we are talking about psychosocial risks and musculoskeletal risk, there's one more thing I want to add in the context of the pandemic, because this has become very important. These are data from Europe and actually from 2019, which are provided by the employers. The employers were asked, what is the biggest risk that you see now going into the future? And the employers in Europe, almost 60% have said, actually more than 60%, yes, musculoskeletal, that on the left, and then also dealing with difficult customers and patients, which is on the right there. But in the middle there, you have prolonged sitting. And you have to think about this. Also, our previous speaker talked about health promotion or exercise important, but prolonged sitting is a risk factor identified, and that could be the case going ahead because all these new technologies mean that we don't need to move as much. We could be sitting on computers and tablets and iPads and be doing our work. And that is something to think about because it could be said that sitting is the new smoking, and it might give rise to all different kinds of chronic diseases. And here is an interesting report that was released in September this year by the ILO about non-communicable diseases, that 81% of the deaths globally are happening because of chronic diseases. And now, chronic diseases includes cancer, yes, and chronic obstructive pulmonary, COPD, because of chemicals and dust, yes. But look at that, those two pieces in between, or the stroke, vascular health and ischemic heart disease. because of work. And what are we talking about that? And that's what I was sort of trying to get to in the previous slide. Prolonged sitting might lead to sedentary work, more screen time, stress, long working hours, less physical activity. All that could lead to more deaths, more disability going into the future, because the nature of work is changing, and that will impact both our psychological health but also physical health. And we as OSH professionals must understand and appreciate that these things are not very traditional OSH, but likely that is where we might be going. In fact, in Norway, we have a paragraph in our Working Environment Act, paragraph 3-4, that says that the employer should see to it that there is enough physical activity at work and promote health in that. But we don't use it as much today, but we have it. But it is likely in the future there is a role for the employer to think more holistically about musculoskeletal, psychological, but also these kinds of diseases like hypertension and stroke, how we could prevent them, because it's work-related stress plus sitting time plus working time uh, and range of other things. Which brings me to, I just wanted to mention a few future technologies that we are talking about here. One is 3D printing, and that's a great technology. You could print anything from buildings to shoes. The concern there is dust exposure, different kinds of dust, nanoparticles among others. So in one way, it's a great technology because you could take the worker from the hazard, but the kinds of dust and the amount of dust generated remains unclear. Collaborative robots, we typically work with machines with a barrier in between, but when we start working together with the robot, like collaborative robots, if there is a sensor failure, that hand could hit you and that could be fatal. Exoskeleton is an excellent technology, hydraulics technology used to support arms and legs and back, and so less musculoskeletal problems. But it is said that misfit of these exoskeletons could lead to pressure sores and breathing problems. And also, these exoskeletons that have been developed are largely developed for men, so it's not very gender sensitive either. So we are looking at technologies going ahead that need an OSH perspective and OSH risk assessments. That brings me to the last part of my presentation. Abdul Qadir, how much time do I have before I take this up?
Go ahead. You can. We have some few minutes.
Okay. All right. So last part of my presentation is about migrant workers. And as I said initially, that in a global context, you could look at this as a migrant worker issue, but this could be also within each country, because this is an economic issue. People moving from less economical developed areas to more economically developed areas. Like we saw in the first slide with the matchstick workers, they came from farmland, poorer areas of Norway to Oslo, which was a richer area. Here is a picture from Gapminder. On the y-axis you have health and the x-axis you have money. And you will see that countries like USA is on the top right there. Norway is also on the top upper right. Countries like India, Pakistan, Kenya are in the middle there, and even China. And how is global migration happening? It's happening from the poorer countries to the richer countries. And the parallel in probably in Nairobi is that migrant workers are moving from farmland of Kenya to Nairobi or to Mombasa. So there is a parallel here, but you could also look at it internationally. I understand, for example, a lot of Kenyan workers go to the Gulf countries, and what happens to the OSH? So you could have that perspective when I talk about this part of my presentation. And migration is important because richer countries need labor, and migration will continue to happen also in the future, both within countries and across countries. So here is a picture from Norway. These were perhaps the first migrants to Norway in the modern times. So these were Swedish families who came to uh, the mines of Norway in 1890s. And here the employer made them sign a contract or rather a letter, and which they sent to the labor inspectorate and said that labor inspection should not come in here because all this is our family, and we don't want the labor inspection here. We are all good and fine. They didn't get that opportunity, but there were a lot of deaths and sickness amongst these first migrant workers who came to Norway in modern times. And these were from Sweden, east of Norway, right? Because they also came in for a better future for themselves and their kids that time, just like the matchstick workers in Norway in 1800. So this was about 1893 and around that period. We had child labor, we had tremendously horrible working conditions for the kids and the workers at that point in time. But if we cut to today, what is happening in Norway today? Because East has broadened. We still get workers from Sweden, but the largest majority of migrant workers in Norway is Polish workers who come from Eastern Europe. And how does this look? You know, this is an incidence for deaths at work, occupational deaths at work. It's 1.4 per 100,000 workers. But when you put in migrant workers, then you see, especially for Eastern Europe, right there in the middle, relative risk is that if you are from Eastern Europe and working on a Norwegian work site, the probability, or rather, of dying at work, or the relative risk of dying at work, is 3 times as high as a Norwegian worker. And the intuitive thing is, yes, that must be because of the language, and that must be because of their culture. But is that the only explanation? Is the question here. And that is what I would like to use some time here on, going back to history, because this thing about individualizing the risk is quite old. And no offense to my psychological colleagues who were providing WAFIA before me, but there is a history to occupational safety and health, and the focus on the individual, or blaming the individual for safety and health. This is a picture from early 1900s. It was in United States, the development of occupational safety and health took place. It was partly inspired by Sigmund Freud, who said that some people seek accidents because it is something to do with their personality. It has something to do with that they are accident prone. It has something to do with their genetics, their color, their race, or something like that. So here you see there's a worker sitting, and these were psychologists and psychiatrists giving small shocks to a worker to find out if he is accident prone. They used to look at how he reacts, how his pupils react, and sort him out as, okay, this guy is accident prone, he should not work. And that was the theory, to focus on individual characteristics, to say that is the cause of accident. And that was the dominant theory for 50, 60 years, that accidents happen because the person, the individual, is accident prone. It is fault of the person. That was the central theory, and maybe it is still is in many countries. But if we move on to another perspective of why accidents happen, again in the United States, a woman's perspective. This was a lawyer in Pittsburgh, and she got some money from a nonprofit agency. And because there were a lot of migrant workers from Russia, a lot of black workers, Chinese workers who were getting injured, who were dying at work. And she did something called the Pittsburgh survey. You can Google it and find more about it. And she said, of course, language and culture, all those things are important, but the employer first has to see to it that he provides safety implements on hazardous machines, that the workers are not working 14, 16, 17 hours. They're not working at heights without any protection, a lack of safety measures in general. And the employer's OSH responsibility is the first thing we should look at. We should look at eliminating hazards, not finding why this individual worker should be blamed because he is accident prone. So that was a different perspective. That's what we call the environmental perspective. Focus on the environmental hazards in the working environment, on the machines, on the chemicals first, and then go to the individual and try to fix the individual. Understand that, changing behavior is very difficult. You can change systems and put put a scaffolding on a building while construction easily, but to change behavior, it takes lots and lots of time. So that was the idea. It's psychology on one side, as opposed to engineering interventions or system interventions on the other side. So this is a picture from Trondheim, where I live. An inspector sent this to us. This was a Polish worker on the, 4 or 5 probably meters above the ground. And if you fall from that height, you could get fatally injured or seriously injured. And I often tend to ask, is this okay? What should be done? And I often get this answer, oh, you should give him a helmet, and then that's good. Is it? Can a helmet save him from falling down? Probably not. It might save him from a serious head injury, but he might still break his hand and feet. And so it will not, the helmet will not prevent him, and neither will learning the Norwegian language or culture will prevent him from falling down. So, and I said that with the helmet because helmet requires an individual action. He has to take it and put it on. Don't get me wrong, helmet is very, very important, but helmet will not help him prevent from falling. The language, if he could speak Norwegian, this Polish worker, it will not prevent him from falling. Or you could say it's a Kenyan worker working at the Qatar football stadium, and he's working like this, without a helmet, or even if it has a helmet, it will, if he loses his balance, he's going to fall. So here is the entire idea here. And this is inspired from what I said earlier. So the yellow parts here is the best way to work. So the first thing is, if you could do that painting job with an extended brush, don't climb high. But that's not always possible. Okay, the next thing you could do is have working at height with the scaffolding and guardrails. That's the best thing, because that will always prevent the fall, because it will be protective to men and women, young and old, Polish, Kenyan, Indian, Chinese. It gives universal protection. Or you can use a elevated platform. It's expensive, but the things down here, which are orange and red, they are also very good, including the helmet, but they all require individual action. They require an action to put the helmet on, or put the belt on, or put the harness on. And we should have that too. But the way to start a risk assessment is not to look at the individual first, see if you can fix the system. And that is by eliminating the hazard. And that works also for asbestos and chemicals, or if you're trying to prevent noise at work, first look at if you can prevent the noise at the source and also provide hearing protection device. That's important. But if you stop it at the source, you will protect everybody really well. So the entire idea is hierarchy of controls, and it is based in the science of partly on psychology and partly on engineering, that we have to try to eliminate hazard first and do the things that are individual based, which is PPE or language or culture. Anything that requires individual action is important, but that comes in last. And that is actually put into our laws in Norway and Europe, and in the ILO conventions, the hierarchy of controls. So always think elimination of an hazard first, substitution, engineering, and PPE, like the helmet, is important, but it is more important to eliminate the hazard or have the scaffoldings or guardrails. Uh, those will help you from preventing the fall. The helmet will not prevent the fall. The language will not prevent the fall. And this is scientifically based. And I'm assuming that Kenya and Kenyan authorities also follow this kind of hierarchy of controls. So to summarize, we talked about platform work and the problems of platform work. We talked about climate change and how we, as OSH professionals, should think about that climate change will impact OSH of outdoor workers and rescue workers. The pandemic, there should be, OSH professionals should work with public health professionals and make them understand that OSH risk assessments are important in times of pandemic, now and in the future. Integrate OSH into emergency preparedness plans. Think about home office challenges with regard to ergonomic and psychosocial risks going ahead, but also think about NCDs, also non-communicable diseases, sitting time. All these new technologies are going to make us more sedentary. We are going to get less physically active. You're going to sit in rooms in front of screens. That will have impact on other kinds of diseases like stress and hypertension and heart diseases, and we have to think about it more holistically. And finally, migrant workers, don't individualize the risks. This is not, like I said, about migrant workers. It could be about migrant workers coming from farmland, Kenya to Nairobi or Mombasa. They might belong to a different class, might have a little bit different culture. So when you consider OSH interventions, first think about how you could fix the system for everybody, and then you could go to the individual attributes. So my take home point actually is, regardless of whichever technologies you use, remember the hierarchy of controls, because that is effectively proven over 70, 80 years in laws and science. It will also help us in the future. So I'll end with that. The change is constant. We all have to change. And if we adopt as OSH professionals to these changes that are coming now and beyond, we'll all thrive. Our profession will thrive. Asante. Thank you.
Karibu sana, Yoginda. Mary, are you there? If we have any questions to Dr. Samant, this is your opportunity. I think we'll take just a few questions, and we need to take a break, and we're a bit behind time. So two questions or something like that, if we have any, on changing nature of work. Very interesting issues mentioned in the presentation. If you have any question, you can raise up your hand, or you can write in the chat, and we will take this. And also, I hope Dr. Saman doesn't mind that maybe we can send some questions by email at a later stage, when people have digested this properly and come up with questions.
Yeah, it is a lot to take in. So, but I'm more than happy to take any questions now. But I'll have to leave in about 10 minutes. So, unfortunately, some other commitments. But if there are any questions now, I'm happy to take any. And please feel free to contact me. And Abdul Qadir, you might also want to share the link of the report, The Future of Work, with people.
Yes, we'll do that.
Yeah, thank you, Simon, for your kind comment. Appreciate that.
If there are no questions at the moment, we still, as I mentioned, we still have opportunity to send questions to Dr. Samant. So just write them in the chat, and we'll take them. Thank you very much, Dr. Samant, for this wonderful presentation, for the nice time. I know all the speakers are from outside Kenya have to wake up early in the morning on a Saturday to come up and be with us. We appreciate this very much, and we hope you've presented in our workshop earlier, so we hope you'll continue presenting in our events. Very useful information from your side. So
yes, thank you. Thank you, Abdul Qadir, and thank you to the audience to be patient, Harriet and Chris and Simon and everybody. So Asanta, and have a great meeting going ahead.
And have a great day for you, and we hope to see you again some other time.
Sure.
Thank you very much. And
thanks. Bye-bye.
Bye.